It is one of the most common procedures performed by oral surgeons, the extraction of wisdom teeth.
Here to tell us more this morning, Dr. Bart Farrell and Dr. Dale Misiek with Carolina's Center for Oral and Facial Surgery. Good morning to both of you. Thanks for being here.
Good morning. Thank you for having us.
I was just grilling them before the segment started because I've got kids about the age, you know, when you start to get the wisdom teeth out. First off, Dr. Misiek, we'll start with you. What are the wisdom teeth?
Well, the wisdom teeth, or third molars, as they're otherwise known, are the last permanent teeth that develop and ultimately erupt in the mouth. And because a lot of people really don't have enough room for these teeth, they come in an abnormal position, crowded, and can cause many problems.
So what are some of the signs of this eruption in your mouth by the wisdom teeth?
Well, you can have pain, infection. It can cause decay of the wisdom tooth or the adjacent tooth. Any type of damage to the adjacent tooth is really what we're looking for. But it can have cysts, pathology, pain. We look at those situations and decide whether they need to come out.
Do most people need their wisdom teeth taken out?
Well, not everybody needs their wisdom tooth out. I think a lot of it has to go with what kind of symptoms that they have, and especially if they are asymptomatic and they're truly followed, you may be able to go ahead and have your wisdom teeth stay in indefinitely. However, many times, and it's really important for you to have them followed by your dentist because you may have some symptoms or you're asymptomatic actually when there's actually damage being done underneath the gums.
What can happen if you don't have your wisdom teeth removed and you need them to be? You mentioned crowding in the mouth. I would venture to guess it can, if your teeth are straight, it will make them go back to the way they were before braces.
Crowding is a big concern, but truly the matter is if there's not enough room, there's going to be some sort of damage to the teeth. If you look at our x-ray here, you can see decay of the adjacent teeth, which is probably the biggest and most important region is hygiene. If we can't clean around these teeth, they need to be evaluated and removed. And in this x-ray, there's a cyst developing around a wisdom tooth. So we would need to catch that, remove it before any type of damage is done.
So if you don't have those, I mean, there's a lot of health risks associated with that. If you don't have it done, is it really detrimental? Because I never had my wisdom teeth taken out.
It can or not. Each patient's different from person to person.
Right. We actually like to advise patients, if they're not going to remove their wisdom teeth, to at least have them monitored on a regular basis, because there's oftentimes many things that can happen that you're really not aware of. And you have to have it evaluated clinically as well as radiographically. Here's a case of a wisdom tooth that's causing decay on the adjacent tooth, and you may not have problems or pain until the very end when you ultimately need to have both teeth removed. Cysts are oftentimes totally asymptomatic, and they'll just do local destruction of bone and leading to major surgical procedures to go ahead and remove them.
What's a good age to have your wisdom teeth removed?
Well, it can vary from patient to patient, but I just say a good golden rule of thumb as a teenager, you know, 14, 15, 16, the roots truly are not fully developed, so the surgery's easier, the recovery's shorter, and the risk of taking out teeth, we always talk about risk, is much less than, say, if someone like me had to get it done.
Okay, what is involved in this whole deal? Because I remember my wife had it taken out, and her mouth was like that for like 8 days.
What's involved in the wisdom teeth surgery?
You have to take it out.
Well, basically, most wisdom teeth are either completely or partially covered by both soft tissue and bone. So when we actually are doing a procedure, we have to access the tooth. We have to make an incision in the gum tissue, and we'll have to go ahead and expose the tooth. And as you see on the little video, that the incision is made along the teeth. We expose the tooth.
Oh, wow.
And the tooth, actually, you can see part of it, and then we'll remove some of the bone around the tooth just to be able to access it. And then ultimately, we will go ahead and cut the tooth into pieces so that we don't have to remove too much bone.
Your job is really hard. Your job is really hard.
Not all wisdom teeth require that. There may be teeth that are erupted in the mouth so that we don't have to do any of the soft tissue work, which actually can benefit the patient because you're not going to have nearly the amount of swelling or discomfort postoperatively.
That's good. What are the anesthesia options?
You can do multiple things, and a lot of it is individual patient driven. Local anesthesia can always be done alone, just like you would if you went in for a filling. You can do local anesthesia plus nitrous oxide, also known as laughing gas, which can give you a little relaxation, or you can go all the way to sleep. And if you go all the way to sleep, it's going to require a recovery period afterwards.
What is the downtime, the recovery time, like after you have your wisdom teeth removed?
That can vary.
Yeah, I would say 2 to 3 days is the golden standard, but, you know, each individual, you know, someone could be 4 or 5 days, someone could be 2 to 3 days, just depends.
And quickly, what is dry socket? I heard this term before a lot.
Dreaded dry socket. So dry socket truly is just a symptom. It's pain. It's truly pain, and it's rare. It's very, very rare. When we take out a tooth, we're left with a cup where that tooth is, and it develops a blood clot that acts like a Band-Aid for us. If that blood clot were to dislodge or dissolve, it leaves exposed bone, which truly gives us this throbby, achy pain, and we can treat a dry socket within about 10 seconds. It just requires a little medicated dressing.
Okay.
I know that summer is a busy time for you with the kids getting out of school. A lot of folks schedule their appointments and have these surgeries done. Carolina's Center for Oral and Facial Surgery is offering a complimentary consultation and x-ray now through the end of summer. Just mention Charlotte today for the special offer. Visit mycenters.com, mycenters.com, or call the number we're about to put on your screen. It is 704-347-3900. Again, 704-347-3900. Thank you so much for being here today. We appreciate your time.
Thank you very much.
All right, well, coming up on Charlotte today, how to make your body butter. Our next guest has a simple recipe anyone can do, even the kids, and to make great gifts too.
Plus, ever wonder what it's like to race 170 miles around Charlotte Motor Speedway? We went for a ride in a pace car.